I need to ask you something important. How many pills do you take every day? If the answer is more than 2, please watch this entire video before you take your next dose, because there are 5 specific pill combinations that are being taken by millions of seniors right now, today, this morning, and the people taking them have no idea that the combination, not the individual pills, but the combination, can be quietly damaging the heart, the kidneys, the brain, and the blood. Your doctor prescribed each one for a good reason. I am not telling you to stop taking them. I am telling you that what happens when certain pills meet each other inside your body is something most patients are never warned about. And in seniors over 60, the consequences of these combinations are more serious and more common than most people realize. Stay until the end, because the 5th combination on this list is the one that surprises people the most. And it involves something that millions of seniors take every single day thinking it is completely harmless. Welcome back. Today we are talking about drug interactions, specifically the 5 most dangerous pill combinations for seniors. Now, before we go through the list, I want you to understand something important. The medicines on this list are not bad medicines. Most of them are prescribed for very good reasons: blood pressure, pain, sleep, anxiety, heart health. But the human body after 60 processes medicines very differently than a younger body does. The kidneys filter medicines from the blood more slowly. The liver breaks them down less efficiently. The body has less water content, so medicines become more concentrated, and the brain becomes more sensitive to chemical changes. This means that 2 medicines that are each individually safe can create a dangerous reaction inside a senior's body that would not happen in a 35-year-old taking the same combination. This is not rare. This is happening every single day in homes across the country, and it is one of the leading causes of emergency hospital admissions in adults over 65. Write down the combinations we are about to share, check your own medicines, and bring the list to your next doctor appointment. Combination number 1, blood pressure medicine combined with pain medicine. Specifically, blood pressure medications like lisinopril, ramipril, or any ACE inhibitor or ARB, combined with anti-inflammatory pain medicines like ibuprofen, naproxen, or diclofenac. These are 2 of the most commonly prescribed types of medicine for seniors. Millions of people take both. Here is what happens when they meet inside the body. The anti-inflammatory pain medicine causes the kidneys to retain sodium and fluid. It also reduces blood flow to the kidneys directly. The blood pressure medicine works partly by relaxing the blood vessels going into the kidneys. Together, these 2 effects can dramatically reduce the blood supply reaching the kidney tissue. The kidneys begin to struggle. Kidney function declines. In seniors, whose kidneys are already working at reduced capacity due to age-related changes, this combination can trigger acute kidney damage, sometimes within just a few days of taking both medicines together. Many seniors take ibuprofen for knee pain or back pain, while also taking their daily blood pressure tablet. They have been doing it for years. They feel fine. But a blood test showing kidney function would often tell a very different story. The simple rule: if you take blood pressure medicine, do not reach for ibuprofen or naproxen for pain. Ask your doctor or pharmacist about alternatives. Paracetamol, acetaminophen, is significantly safer for the kidneys when used correctly. Combination number 2. Blood thinners combined with aspirin. If you take warfarin, rivaroxaban, apixaban, or any anticoagulant blood thinner, and you also take aspirin regularly, even low-dose aspirin, this combination significantly increases your risk of serious internal bleeding. Both medicines reduce the blood's ability to clot. Taking them together does not simply add the 2 effects, it multiplies them. The digestive tract, the stomach and intestines, is particularly vulnerable. Bleeding can begin slowly inside the gut, producing no pain, no obvious symptoms. The first sign might be black or dark stools, extreme fatigue, or a collapse. Many seniors were put on low-dose aspirin years ago, when guidelines recommended it widely for heart protection. Guidelines have since changed. Many doctors have not reviewed or discussed this with their patients. If you are taking a blood thinner and you are still taking daily aspirin, please ask your doctor specifically whether you still need both. The answer for many people is no, and stopping the aspirin where appropriate can significantly reduce bleeding risk. Combination number 3. Sleeping tablets or anxiety medicines combined with pain medicines that affect the brain. Specifically, benzodiazepines like diazepam, lorazepam, or temazepam, or Z-drugs like Zopiclone or Zolpidem, combined with opioid pain medicines like codeine, tramadol, or morphine. Both of these medicine types slow down the central nervous system. The breathing rate slows. The brain becomes less responsive. The reflexes dull. Individually, at the right dose, each can be managed carefully. Together, Especially in seniors whose bodies process medicines more slowly, the combined sedation effect can suppress breathing to dangerous levels. This is a well-documented cause of medication-related deaths in older adults, and it is far more common than most people know. If you take any medicine for sleep or anxiety alongside any medicine for pain, please tell your doctor you are taking both. Ask specifically whether the combination is safe at your doses and your age. Never increase the dose of either medicine without telling your doctor you are taking the other. Combination number 4. Diuretics combined with certain blood pressure medicines combined with hot weather or illness. This one is not a two-medicine combination, it is a situation. Diuretics, water tablets, are taken by millions of seniors for blood pressure, heart failure, or fluid retention. Common ones include furosemide, bendroflumethiazide, and hydrochlorothiazide. These medicines work by making the kidneys remove more water from the body. Now add a second blood pressure medicine, and then add a hot day, a stomach bug with vomiting, or simply not drinking enough water. The body loses fluid from multiple directions at once. The blood pressure drops, sometimes dramatically. The result is dizziness, confusion, fainting, and falls. Or in more severe cases, the blood pressure drops low enough to reduce blood flow to the heart or brain at a critical moment. This is called volume depletion, and it sends thousands of seniors to hospital every summer without them or their families understanding exactly what caused it. The rule is simple but important. On very hot days, or if you have a stomach illness that is causing vomiting or diarrhea, contact your doctor about temporarily adjusting your water tablet dose. Do not do this without guidance, but do ask. And drink water consistently every day, not just when you feel thirsty. Combination number 5. And this is the one that surprises people the most every single time. Common supplements combined with prescription blood thinners, specifically fish oil, vitamin E, garlic supplements, and ginkgo biloba, combined with warfarin, aspirin, or any anticoagulant. These are supplements, available in any pharmacy, taken by millions of seniors every day, completely natural, completely safe on their own for most people. But each of these supplements has blood-thinning properties. Fish oil at high doses thins the blood. Vitamin E at high doses thins the blood. Garlic supplements thin the blood. Ginkgo biloba thins the blood. When any of these are combined with a prescription blood thinner, the combined effect can push the blood's clotting ability dangerously low. And here's the critical problem. Most seniors do not tell their doctor about supplements. They do not think of them as medicines. They were bought over the counter. They are natural. Surely they do not count. They count. When your doctor asks what medicines you take, supplements count. Herbal remedies count. Vitamins at high doses count. Every single thing you take on a regular basis, prescribed or not, needs to be on the list you bring to your doctor. This one change alone, simply disclosing your supplements, could prevent a serious bleeding event. Now here is what you need to do today. Take out a piece of paper or open the Notes app on your phone. Write down every single thing you take regularly. Every prescription medicine, every over-the-counter pill, every supplement, every vitamin, every herbal remedy. Write the name, the dose, the time of day you take it. Take that list to your next doctor or pharmacist appointment and ask one specific question. Are there any interactions between these medicines and supplements that I should know about given my age? That question, those words exactly, it signals that you are informed. It gives the doctor or pharmacist everything they need to check properly, and it may reveal a combination that has been quietly causing problems for months without anyone realizing. A pharmacist can do a full medication review. In many places, this is a free service. It takes 20 to 30 minutes, and it can identify dangerous combinations that slip through the cracks of multiple separate specialist appointments. Before we finish, let me be completely clear. Do not stop taking any medicine because of this video. Every medicine on this list was prescribed for a reason. Stopping suddenly can cause serious harm. What this video is asking you to do is have a conversation, an informed, specific, confident conversation with the person responsible for your care. You are not questioning your doctor. You are helping them help you better. Because the full picture of everything you take, prescribed and unprescribed, is information only you can provide. Today we covered the 5 most dangerous pill combinations for seniors. Blood pressure medicine with anti-inflammatory pain medicine. Blood thinners with aspirin. Sleeping or anxiety medicine with opioid pain medicine. Diuretics with other blood pressure medicines in heat or illness. And supplements, fish oil, vitamin E, garlic, ginkgo biloba, with blood thinners. Write the list, check your medicines, ask the question. Share this video with every senior you know who takes more than 2 medicines a day. That is the person who needs this information most. Subscribe for a new video every week. Simple, honest health information made just for you. Take care of yourself. We will see you next time.